Despite spending nearly 20% of the United States GDP on healthcare, the US ranks last overall on health outcomes among high income countries, including having the highest infant mortality rates and lowest life expectancy. It's like unbelievable.
No, I mean,
It's
that's
unbelievable.
depressing. I mean, but those are the facts. And you have to understand those are indisputable data, right? And so when people hear that, they go, but when you look at kind of the system, and I don't blame doctors because doctors are get into this field. I was on the admissions committee to UT Medical School for a number of years. So we interviewed a lot of these young kids, figure out what their motivation was. Will they have a successful career in medicine? And almost everyone, I mean, there's always the exception, but everyone gets into medicine because they want to make a difference. They're driven by curiosity, and most of them want to leave a lasting legacy and help people. That's what drives entry into healthcare. But when you look at the system in which they're trained in, it prevents them, it basically handcuffs them. Because when you figure out the economic model of medicine, once you make a diagnosis, now you've got a diagnosable disease to which you have a finite number of responses, right? If you make this diagnosis, that's called an ICD 10 code, which is reimbursable, and that's how you get paid. So once you make a diagnosis, you only have a finite list of things you can do. You can't ask that question and go, well, what's really causing this, and spend 90 minutes with that patient, because most physicians have to see 60, 70, 80 patients a day to pay the bills,
Mm.
to cover their overhead. So it's a factory. You come in, you look at, you've got a transcriber, you make a diagnosis. Okay, I'm going to prescribe this medication. Come back in 2 weeks or 6 months, and we'll see where you are. And then it's a churn, it's a mill. But as you meant, the data don't lie, right? Sickest population, highest infant mortality in the most industrialized nation in the world.
And according to the data, Americans are spending about 13 years of their life living with disease, and that is significantly higher than many other high income Western countries. So although life expectancy, might be 78, 80 years old, you're going to spend almost 15 years of that time living with disease. So your health span is really probably the more important thing to be focusing on, not your lifespan.